I think it's really important if we're going to have a real heart team, we need to be academically consistent. Okay, so what do I mean by that? Okay, so this happens all the time. We get a patient like this. So let me just change my slides. Like this, who is 77 years old and has a area of 332. So if we look at our little handy dandy sizing chart, that sizes to a 20 millimeter S3 if we're going to do that. But we'll often get someone that says, I'm not going to put a 20 millimeter S3 in the patient. It's too small. I'm going to do a 23 evolute or I'm going to do surgery. Well, let's investigate that concept, right? So as I told you before, the actual opening of these valves is not the size that they are marketed as. So a 23 evolute is actually a 20 millimeter valve. A 26 evolute is actually a 22 millimeter valve. A 29 is a 23 and a 34 is a 24. So a 23 evolute is not a larger valve than a 20 S3. It's a 20 millimeter valve. And so if you don't believe me, here's some experiments I've actually done. So this is an actual evolute valve, and that I've actually cut the top off so I could get my calipers in there. And sure enough, the inflow is 23, but at the level of the leaflets, it's a 20 millimeter valve. So it is not a larger orifice. Now, if you don't believe me, you can also ask Medtronic. This was something that was sent out to all of us that have done these valves in the past. This was an urgent field safety notice a few years ago. What was happening is people were doing a post-dilatation and they were using too large of a balloon and then tearing the leaflets and causing problems. So Medtronic sent this out and said, well, here's our 4 sizes of valve. This is the largest size balloon that you should use. And sure enough, it's a 20 millimeter balloon for the 23, a 22 for the 26, a 23 for the 29, and a 24 for the 34. So they're telling you here, spelling it out, that that's the actual size of the valve, and that's actually what we know from the geometry.